Hi there folks, this is Dr. Burke Mays with Pathways Integrative Health Center. In our office, we deal a lot with people dealing with long-term chronic conditions. And very commonly what we find underlying a lot of health issues is an undiagnosed thyroid issue or a thyroid issue that's not responding to the standard care approach. And a really common question I get a lot of the time is, Dr. Mays, how does my digestion affect my thyroid? So to cover that, I just kind of have to cover some basics on how your thyroid works. So up here in your brain, particularly your pituitary senses when you need more thyroid hormone. Releases a hormone called TSH, goes down to your thyroid, and you make your thyroid hormones. About 93% is a form called T4, and that is the inactive form. That T4 feeds back up to the brain and tells the brain to either make more or less TSH based on the levels of the T4. Kind of a little more about that later. And then T3, that's the active form. That's kind of like the key in the lock that turns on the machine. That gets carried out to your cells, binds to the cell receptors, and turns your cells on. And that gets carried by a protein called thyroid binding globulin. It's like a taxi cab, it's like a transport mechanism. And then here your T4, with about 94% of what you make, that gets carried down to several different places. We're going to talk today about the gut. In your gut, what happens normally is you take your T4 and make it into T3, which then gets carried out to the cells, and that requires an enzyme called 5' deiodinase. I'm not going to quiz you on that, but the point is it's an enzyme that's very dependent on the proper environment to work. It needs good bacteria around it. It needs good gut function. Needs good absorption because it's very dependent on some key nutrients. Vitamin A, vitamin D, zinc, selenium are some of the big players. So if you kind of tie back into how gut function affects things, if you have malabsorption issues where you're not absorbing your nutrients properly, you're not going to absorb those key nutrients in. You don't have the proper building blocks to make your thyroid hormones. There's what we call dysbiosis. Dysbiosis is a bunch of different things, kind of boils down to the balance of your good and bad bacteria is off, or you don't have the right bacteria in your gut. We're learning more and more lately about the impact we call the microbiome, the bacteria that have residence in your GI tract, and their impact on your health. You have to have the right balance of your good and bad bacteria. Inflammation, if there's chronic inflammation from food allergies, from that's the big cause. With food allergies, toxicity, immune system breakdowns, that affects your gut, and now it's going to affect the whole conversion from T4 to T3. Now it happens if you're not converting T4 to T3, you're not getting the T3 out to your cells to turn the cells on, so you act like you're hypothyroid. But then that T4 feeds back up and tells the brain, well, we're here, we don't need to make more TSH, so everything's fine. And that can lead to those symptoms of hypothyroid. So if you've been dealing with this for a while, not getting the right answers, give us a call. We offer a courtesy consultation over the phone to see if what we do in our office can be a match for you, to see if we make a difference in your health. Otherwise, look forward to seeing you on some other videos, and thanks for watching.